I'm here with Natalie, and I want to know how you found the first day of the conference. What about your first session? What did you do there?
So our first session that I covered was on kindness in healthcare and the importance of being kind and how that can potentially transform people's experiences of care.
Mm-hmm. What kind of things did you do in that session? Was it interactive or?
Yeah, so it was an interactive session. So people were sort of like initially sort of sharing their kind of thoughts. So whether that be about like the research that kind of supports the fact that, you know, being kind improves the experiences for kind of the workforce, which in turn supports the experiences of patients and carers of services. And then people had an opportunity to also practice some of the different tools that people used.
Amazing, brilliant. So what did you feel like was your favourite part about that session?
So I think when we're thinking about like healthcare kind of excellence, I think conversations around kindness are often absent, which I think is, you know, really important, in particular when we think about the experiences of healthcare workers in terms of their experiences of like discrimination and bullying and harassment, and kind of really bringing that to the fore. I think that that's really, really important. I think one of my reflections though was that what was probably kind of what I would have liked to have seen would have been a conversation about like who is afforded kindness. And I think that for me was slightly missing, I think, from that conversation.
But did you kind of maybe speak about that a bit more in your second session? Because that was about equity, right?
Yeah, so the second session, I was very surprised actually, because I think I've been sort of working in this space for a while. And yeah, you know, we were starting to hear people talk about like systemic racism and using terminology like systems of oppression, which you just generally don't kind of hear. So that was really, really comforting, I think, because it means that the conversation about systemic racism is kind of moving. Again, I think what I would have really liked to have seen was more of a conversation about like the kind of significance of like the historical aspects of like why racism shows up in our work. I think would have been really helpful, and for although it was like, again, really great seeing the tools that people are kind of using and how they're using it to advance equity in their work, I feel like we also need to be talking about the importance of like embodying anti-racism. So I think that's, my reflection.